In this lecture, the osseous, articular and muscular structures of the shoulder complex will be discussed. The pectoral girdle is composed of two bones, the clavicle and scapula. It overlaps the superior and posterior lateral aspects of the thoracic cage. The primary function of the pectoral girdle is to provide the bony platform for movements of the upper limb. Unlike the pelvic girdle, the pectoral girdle forms an incomplete ring around the axial skeleton and is non-weight bearing. Anatomically, the bones of the pectoral girdle are involved in three true joints. The sternoclavicular joint, which lies between the manubrium of the sternum and the clavicle. It is the only articulation of the upper limb with the axial skeleton. The acromioclavicular joint, which lies between the clavicle and scapula, and the glenohumeral joint, which lies between the glenoid cavity of the scapula and the humerus of the arm. Gross movement of the pectoral girdle and limb most often requires upper simultaneous involvement of all three of these articulations. Functionally, the pectoral girdle is sometimes described to feature another joint, known as the scapulothoracic joint. This can be defined as a conceptual or physiological joint, in which movement occurs between musculoskeletal structures of the scapula and the thoracic cage, rather than a true anatomical joint, which involves direct bony articulation of two or more skeletal elements. The scapula is located in the pectoral girdle of the upper limb, positioned on the posterior lateral aspect of the thoracic cage, between the second and seventh ribs. The body of the scapula is the large triangular part of the bone. It consists of costal and dorsal surfaces, as well as superior, lateral, and medial borders. The spine of the scapula is the triangular-like projection located on the dorsal surface of the bone. It is continuous laterally with the acromion. The crest of the spine of the scapula is also easily palpable throughout. The neck of the scapula is the constricted superolateral part of the bone. It projects out to the glenoid cavity, which then articulates with the head of the humerus, forming the shoulder or glenohumeral joint. The glenohumeral acromion is the projection from the lateral aspect of the spine of the scapula. It articulates with the clavicle, forming the acromioclavicular joint. The coracoid process is the thick, beak-like projection extending from the lateral end of the scapula's superior border. The coracoid process can be located by deep palpation on the lateral border of the deltopectoral triangle. When the arm is in the anatomical position, the superior angle, the medial end of the spine, and the inferior angle of the scapula can each be palpated at the levels of the second, third, and seventh ribs, respectively. Next, the clavicle, which is the first bone to ossify in utero at about 5 weeks. The lateral third of the clavicle is concave anteriorly, and its medial 2/3 are convex anteriorly. Its inferior surface features the conoid tubercle, trapezoid line, costal tuberosity, and the subclavian groove. The sternal end of the clavicle is the enlarged quadrangular area on the medial aspect of the bone. It articulates with the manubrium of the sternum, forming the sternoclavicular joint. The shaft or body of the clavicle is the long, curved part of the bone. It extends between the enlarged sternal end of the clavicle and its flattened acromial end. The acromial end of the clavicle is the flattened lateral part of the bone. It articulates with the acromion of the scapula, forming the acromioclavicular joint. The clavicle acts as a movable bony strut which supports the position of the scapula and free upper limb, keeping it lateral and independent from the trunk to allow for maximum mobility. The clavicle is subcutaneous, and therefore it is easily palpated throughout its entire length. The humerus is located in the arm, positioned distal to the pectoral girdle. It is the largest bone in the upper limb. The proximal end is the expanded upper part of the bone. That proximal part consists of the head, the greater and lesser tubercles, and the anatomical and surgical necks. It articulates with the glenoid cavity of the scapula, forming the glenohumeral joint, or the shoulder joint. The proximal end of the humerus is not subcutaneous, and therefore not easily palpable. The head of the humerus may be felt by deep palpation of the axillary fossa. The greater and lesser tubercles may be located by deeply palpating through the deltoid muscle, inferior to the acromion and coracoid processes, respectively. Landmarks of the body of the humerus include the deltoid tuberosity and the radial groove. Next, we will review the articular structures of the shoulder complex. The glenohumeral joint is a synovial joint formed between the scapula, particularly the glenoid process, and the head of the humerus. It is a ball and socket joint, a type of synovial joint that permits a wide range of movement. The glenohumeral joint is surrounded by a fibrous joint capsule, and that capsule is lined by a synovial membrane. The capsule is strengthened supero-anteriorly by the glenohumeral ligaments. These ligaments help to prevent superior and anterior dislocation of the shoulder. The head of the humerus, which forms the ball entity of the joint, and the glenoid fossa, which forms the socket entity of the joint, are covered in hyaline cartilage. The shallow glenoid fossa is further deepened by a fibrocartilaginous ring, the glenoid labrum. The joint is strengthened further by rotator cuff muscles, i.e. the supraspinatus superiorly, the infraspinatus and teres minor posteriorly, and the subscapularis anteriorly. The tendon of the long head of the biceps brachii also helps to support this joint inferiorly. The glenohumeral joint is the most freely moving joint in the body due to the large size of the humeral head in comparison to the glenoid fossa and as a result of its slack articular capsule. Movement at the glenohumeral joint occurs around three axes, including flexion extension or in the sagittal plane, abduction adduction in the frontal plane, and medial and lateral rotation of the humerus in the transverse plane. A combination of these movements results in circumduction of the glenohumeral joint. The acromioclavicular joint is a synovial joint formed between the acromion of the scapula and the acromial end of the clavicle. It is a synovial plane joint, with either bone surface slightly convex and the other slightly concave. The articular surfaces are covered in fibrocartilage and are surrounded by a fibrous joint capsule. The capsule is lined by a synovial membrane, strengthened superiorly by the acromioclavicular ligament, posteriorly by the fibers of the trapezius muscle, and anteriorly by the fibers of the deltoid muscle. The acromioclavicular ligaments strengthen the acromioclavicular joint and are complemented by the coracoclavicular ligament. The sternoclavicular joint is a synovial sellar or saddle joint and is the only articulation between the axial skeleton and the upper limb. The joint is located between the clavicle and the clavicular notches of the sternum, and both the articulating surfaces are covered with fibrocartilage. The joint is reinforced by a number of ligaments, including the anterior and posterior sternoclavicular ligaments and the costoclavicular ligament. The synovial joint is completely separated by a fibrocartilaginous articular disc. Next, we will review the muscular structures of the shoulder complex. The muscles of the shoulder are a group of muscles of the upper limb that act on the bones of the pectoral girdle, in other words the clavicle and scapula, and the humerus. They are involved in movements of the shoulder and arm, but also help to stabilize the glenohumeral or shoulder joint. The muscles of the shoulder region consist of the deltoid, supraspinatus, infraspinatus, teres major, teres minor, and subscapularis. The supraspinatus, infraspinatus, teres minor, and subscapularis muscles are collectively known as the rotator cuff muscles due to their close relationship with the glenohumeral joint. These muscles can be remembered using the acronym SITS, or SITS. These muscles work together to stabilize the glenohumeral joint by holding the head of the humerus in the glenoid fossa of the scapula during its movements in various planes. Overall, the deltoid muscle is the thick triangular muscle that gives the shoulder its rounded contour. The deltoid muscle is located superficial to the glenohumeral joint, the proximal tendons of the biceps brachii and triceps brachii muscles, and the axillary nerve. It is lateral to the pectoralis major, trapezius, and infraspinatus muscles. The deltoid muscle is involved in multiple actions. It abducts the arm at the glenohumeral joint when all three parts contract together. It flexes and medially rotates the arm at the glenohumeral joint when the clavicular part contracts individually. And it extends and laterally rotates the arm at the glenohumeral joint when the scapular spine part contracts individually. The deltoid muscle can be tested by holding the arm in an abducted at 90 degrees position and then resisting an examiner's attempt to adduct the arm back towards the anatomical position. In other words, resisted abduction. The supraspinatus muscle abducts the arm at the glenohumeral joint. It is one of the four rotator cuff muscles. The supraspinatus can be tested by abducting the arm at the glenohumeral joint against resistance, starting from the fully adducted position. The muscle can also be palpated in this position. The teres major muscle can be tested by adducting the arm at the glenohumeral joint against resistance, during which it can be palpated. The teres major muscle is involved in multiple actions. It adducts the arm at the glenohumeral joint, it medially rotates the arm, it assists in extension of the arm, and it also helps to stabilize the glenohumeral joint. The teres minor muscle is found in the shoulder region. It is a thin, fusiform type of skeletal muscle. The teres minor muscle is involved in multiple actions. It laterally rotates the arm at the glenohumeral joint, it transversely abducts the arm, and it assists in adduction of the arm. The teres minor muscle is difficult to test on physical examination due to the fact that other muscles are involved in lateral rotation of the arm. Therefore, its action is impossible to isolate and test. The subscapularis muscle is a thick, multipennate type of muscle. It is located anterior or deep to the scapula, the glenohumeral or shoulder joint, and the subtendinous bursa of the subscapularis muscle. It is located posterior to the serratus anterior and teres minor muscles and the axillary artery and vein. It is superior to the teres major and latissimus dorsi muscles, and it is lateral to the rhomboid major and minor muscles. The subscapularis muscle contributes to the formation of the posterior wall of the axilla. It medially rotates the arm at the glenohumeral joint, and it is difficult to test on physical examination due to the fact that other muscles are involved in medial rotation of the arm, for instance pectoralis major and latissimus dorsi. However, the Gerber's or lift-off test is often used to test for tears of the subscapularis. In this test, the arm is placed in internal rotation with the hand behind the small of the back, around the mid-lumbar spine. The dorsum of the hand, or the back of the hand, is against the patient's lumbar spine, and from this position, the patient attempts to move the hand away from the lower back by extending and further internally rotating the arm. Next, we will move on to the muscles of the pectoral region, which are a group of muscles of the upper limb that attach to the sternum and anterior parts of the ribs on one end, and to the scapula, clavicle, and humerus on the other. The muscles of the pectoral region consist of pectoralis major, minor, subclavius, and serratus anterior. The pectoralis major muscle is found in the pectoral region of the thorax. It is a large, fan-shaped, convergent type of skeletal muscle. It is located anterior or superficial to the sternum, the first 6 ribs, and their costal cartilages, the pectoralis minor, serratus anterior, subclavius, and external intercostal muscles, and the external intercostal membrane. It is posterior to the pectoral fascia and breast tissue. It is infromedial to the clavicular part of the deltoid muscle. The pectoralis major muscle contributes to the formation of the anterior wall of the axilla, and its inferior margin forms the anterior axillary fold. The pectoralis major muscle is involved in multiple actions. It adducts the arm, it medially rotates the arm, and it depresses the pectoral girdle at the acromioclavicular and sternoclavicular joints. It transversely adducts the arm at the glenohumeral joint and assists in flexion of the arm. It also assists in the extension of the arm. Flexion of the arm is achieved via its clavicular head, and extension of the arm is achieved via its sternocostal head. Finally, it can act as an accessory muscle of inspiration. The 2 heads of the pectoralis major muscle can be tested separately. The clavicular head of the pectoralis major can be tested by transversely adducting the arm at the glenohumeral joint against resistance, during which it can be seen and palpated. The sternocostal head of pectoralis major can be tested by adducting the arm at the glenohumeral joint against resistance, during which it too can be palpated. The pectoralis minor muscle is found in the pectoral region of the thorax. It is a triangular convergent type of skeletal muscle. It is located anterior or superficial to the 3rd to 5th ribs and the serratus anterior and external intercostal muscles. It is posterior or deep to the pectoralis major muscle and the pectoral branches of the thoracoacromial artery. It is medial to the lateral thoracic artery, and it is lateral to the 3rd to 5th costal cartilages. The pectoralis minor muscle is involved in multiple actions. It protracts the pectoral or shoulder girdle at the acromioclavicular and sternoclavicular joints, and it assists in depression of the pectoral girdle at these joints too. It can act as an accessory muscle of inspiration. The pectoralis minor muscle can be tested by protracting the pectoral girdle at the acromioclavicular and sternoclavicular joints against resistance. And then the subclavius muscle is found in the pectoral region of the thorax. It is a small triangular skeletal muscle. It is located anterior or superficial to the first rib, the first intercostal space, the subclavian artery and vein, and the brachial plexus. It is located posterior or deep to the pectoralis major muscle and inferior to the clavicle. The subclavius muscle helps stabilize and control the mobility of the clavicle during movements of the pectoral or shoulder girdle, especially elevation. The serratus anterior muscle is found on the lateral and posterior aspects of the thorax. It is a broad skeletal muscle, and its digitations, found at its origin sites, give the muscle its saw-toothed or serrated appearance. It is located superficial to the first 8 ribs and the external intercostal muscles. It is deep to the scapula, the latissimus dorsi, trapezius and subscapularis muscles, and the long thoracic nerve. It is posterior to the pectoralis major and minor muscles, and it is involved in multiple actions. It protracts the pectoral girdle at the acromioclavicular and the sternoclavicular joints. It upwardly rotates the pectoral girdle at the sternoclavicular and acromioclavicular joints, and it helps to stabilize the scapula against the thoracic wall. It can act as an accessory muscle of inspiration. Because the serratus anterior muscle is used when punching, it is also known as the boxer's muscle. The serratus anterior muscle can be tested by holding the shoulder in the flexed position and the elbow in the extended position, and then pushing the upper limb against resistance, during which it can be seen and palpated. In cases where this muscle is weak or paralyzed, the medial border of the scapula may become prominent on the upper back during a wall push-up, a sign known as winged scapula. Next, we will cover the extrinsic muscles of the back, which are one of 2 subgroups of muscles of the back, the other being the intrinsic muscles. These muscles lie superficial to the thoracolumbar fascia and the intrinsic muscles of the back. The extrinsic muscles of the back are involved in movements of the pectoral girdle, arms, and ribs. The extrinsic muscles of the back consist of trapezius, latissimus dorsi, rhomboid major, rhomboid minor, levator scapulae, serratus posterior superior, and serratus posterior inferior. The trapezius muscle is a large, flat, triangular skeletal muscle that is composed of 3 parts: a descending part, which is the superior portion, a transverse part, which is the middle portion, and an ascending part, which is the inferior portion. The trapezius muscle is located superficial to the semispinalis, spinotransversalis, levator scapulae, rhomboid major, rhomboid minor, supraspinatus, and latissimus dorsi muscles. It is medial to the deltoid and infraspinatus muscles. It's involved in multiple actions. It elevates, depresses, retracts, and upwardly rotates the pectoral or shoulder girdle at the acromioclavicular and sternoclavicular joints. During unilateral contraction, it laterally flexes the head and neck to the same side. During bilateral contraction, it extends the head and neck. Overall, the trapezius muscle can be tested by elevating the pectoral girdle, i.e. shrugging the shoulders against resistance, during which it can be seen and palpated. The latissimus dorsi muscle is located superficial to the inferior angle of the scapula, the 8th to 12th ribs, and their adjacent external intercostal muscles. It is deep to the ascending part of the trapezius muscle and inferior to the teres major, rhomboid major, and supraspinatus muscles. The latissimus dorsi muscle adducts the arm at the glenohumeral joint, medially rotates the arm, and extends the arm. It can act as an accessory muscle of respiration as well. The latissimus dorsi muscle can be tested by adducting the arm at the glenohumeral joint against resistance, during which it can be seen and palpated. The rhomboid major muscle is a thin, quadrilateral type of skeletal muscle. It is located superficial or posterior to the erector spinae, splenius cervicis, and serratus posterior and superior muscles. It is anterior to the trapezius muscle and the accessory nerve. It's medial to the scapula and infraspinatus, and inferior to the rhomboid minor. The rhomboid major muscle retracts the pectoral girdle at the acromioclavicular and sternoclavicular joints. It also downwardly rotates the pectoral girdle at these joints and helps to stabilize the scapula against the thoracic wall. The rhomboid major muscle can be tested by holding the hand on the posterior aspect of the hip and then pushing the elbow backwards against resistance, during which it can be seen and palpated. The rhomboid minor muscle is a narrow quadrilateral type of skeletal muscle. It's located posterior or superficial to the serratus posterior superior muscle and the dorsal scapular nerve. It's anterior or deep to the trapezius muscle and the accessory nerve, and medial to the scapula and supraspinatus and levator scapulae muscles. It's superior to the rhomboid major muscle. The rhomboid minor retracts the pectoral or shoulder girdle at the acromioclavicular and sternoclavicular joints. It downwardly rotates the pectoral girdle at these joints and helps to stabilize the scapula against the thoracic wall. The rhomboid minor muscle can be tested by holding the hand on the posterior aspect of the hip and then pushing the elbow backwards against resistance, during which it can be palpated. You will notice that this is the same test for rhomboid major. The levator scapulae muscle is a thin, strap-like muscle. It is located superficial to the serratus posterior superior and deep to the sternocleidomastoid muscle. It's also deep to the trapezius and medial to the supraspinatus. The levator scapulae muscle is involved in multiple actions. It elevates the pectoral or shoulder girdle at the acromioclavicular and sternoclavicular joints. It downwardly rotates the pectoral at these joints, and during unilateral contraction, it laterally flexes the neck to the same side at the cervical vertebral joints. During bilateral contraction, it extends the neck at the cervical vertebral joints. The serratus posterior superior muscle is a thin, broad, quadrilateral type of skeletal muscle, and its digitations, found at its insertion sites, give the muscle its sawtooth or serrated appearance. It's located anterior or deep to the rhomboid major, rhomboid minor, and trapezius muscles, and medial to the levator scapulae muscle. The serratus posterior superior elevates the ribs at their costovertebral joints during forced inspiration. It also depresses the ribs at their costovertebral joints during forced expiration. The serratus posterior inferior muscle is located posterior or superficial to the erector spinae muscles and anterior or deep to the latissimus dorsi muscle. The serratus posterior inferior muscle depresses the ribs at their costovertebral joints during forced expiration. And that concludes this lecture on the osseous, articular, and muscular structures of the shoulder complex. This lecture was prepared for students in the UCD School of Public Health, Physiotherapy, and Sports Science. Images were taken from the Complete Anatomy software prepared by 3D4 Medical.